So the first case, this is a good one. This is a 60-year-old woman, comes in for a screening mammogram, and I put the big red circle that helps you find the finding right away, right? But this was a little area. I was about to read this as a BI-RADS 2. She had nodular breast pattern everywhere. This looked benign to me. When I looked at the case score, though, it was high. It was 86. So does that mean I have to read it as abnormal? Absolutely not. But I went back and I was trying to find out what caused this high case score. So I saw this 67 over here, and the closer I looked, I saw some irregular margins. Now it's really, there's some trabeculae all over, so you have to make that determination for yourself. But I was convinced enough at this point, okay, yeah, I kind of see something. Let me call this back. Patient comes back in for a diagnostic mammogram, and then on the spot CC, you see those irregular spiculations. Those are that sign of that dystrophic reaction to a cancer. I was pretty concerned after this. I was pretty worried about cancer. So you can see this irregular mass that's hiding this in this tissue in the upper outer breast, right? We go to ultrasound and you see a 7 mm mass with irregular margins, and it's buried in dense tissue. That's why we didn't see it well. We were just seeing kind of the tip of the iceberg here on the mammogram. This is a 7 mm cancer. She proceeded to biopsy. She had a grade 2 invasive ductal carcinoma. And just to make sure, just to keep me honest, the clip was exactly where the abnormality was on the mammogram. I have to be frank on this case. Had I not had a high case score, that would not have triggered me to look at this spot and call this back. This 7 mm cancer would have gone unnoticed for 1 year. And in terms, those of you that aren't familiar with the survivability data, the earlier we catch breast cancer, the better we do from a 5-year, 10-year, and lifetime prognosis. So catching it tiny absolutely matters. So in this particular case, this patient got a very early diagnosis because a radiologist, namely myself, was flagged to look by the software. If I'm reading 16,000 images a day, I need this. That's the lesson that a case like this shows. Again, same thing, the post-biopsy clip in the exact same spot where the lesion was marked.